second myth in obesity is an increase in the body weight is always due to an increase in the body fat. And those with a decrease in muscle and normal body weight do not develop complications of obesity. Ideally, the obesity we call, if the body mass index is more than 25, it is considered as overweight. And if the BMI is more than 30, it is considered as the obesity. Especially, the BMI may not accurately measure the body composition for an individual. So it has its own limitations, especially those with increase in muscle mass like bodybuilders, and those with a decrease in muscle mass, we call now it is sarcopenia. And in different races, different sexes, and even for the postmenopausal woman also. So, public with increased muscle mass may have high BMI and not necessarily have an increase in the percentage body weight, body fat. So, unless it is associated with increased body fat, patients with increased muscle mass do not have an increased risk of cardiovascular diseases and other risk factors like type 2 diabetes mellitus, hypertension, and increase and even cancer also. And some people with reduced muscle mass and may have BMI in the normal range and are low also, but they have increased body fat. Sometimes we call it as sarcopenic obesity. So people with the sarcopenic obesity may have also increased risk of hypertension, diabetes mellitus, even cardiovascular risk factors and cancer also. So how to measure? So the body fat index is it is a lab test. It is done with the equipment. It assesses the both android, that is the amount of the fat in the stomach area, and the amount of fat deposited in the body parts of the body, like liver and other parts. So depending upon the female versus male, the ideal is the body fat index is less than 24% in female and less than 19% in a male. So if we assess the body fat index, sometimes we can diagnose pre-obesity also. So if the body fat index is less than 34% in females and less than 29%, between 25 to 29% in males, it is called pre-obesity feature. And if it is more than 35% in the female and more than 30% in the male, so ultimately the body fat index is the ideal indicator for the obesity rather than the body mass index. The body mass index is only for the assessment of the obesity for general adult population. But individually, if you want to diagnose obesity, is because of the increased body fat index or is increased because of the body mass. So ultimately, is the body fat index is the best investigation for the obesity. Thank you very much. I am Rotarian Dr. Venkateswara Rao, Vizianagaram.